So I wanted to welcome everybody to the Paulsboro PFAS Health Study Community Meeting. We're going to do an update tonight, and we have a special, we have two special guests from our community, from our neighboring community, one from our neighboring community and one from our environmental advocacy community. So we have Hope Gross from the Bucksmont Coalition for Safe Water, and we also have Tracy Carluccio from the Delaware Riverkeeper. We actually asked them to come because not too long ago, there was a report that was put out by the National Academy of Sciences, and lucky us, we have two people, Tracy Carluccio and Hope, were both on the community advisory panel for that study. So we're excited about that study. We think that people in Paulsboro are going to be very happy and interested in that study. So tonight we're putting it out there, and we're going to have these guys discuss what's in the study, and also in just a couple minutes we're going to have Dr. Lumbach come on and give a quick update on where we're at with this study. Tanya, would you like to go first since the mayor's not here? Do you want me to bump you? Tanya Kidd. She's probably, I guess she doesn't want me to bump her. Let me see if she's around. Again, I want to welcome everybody. I want to thank all the people that have been participating on the community advisory panel and the staff in our Paulsboro office. We now have 3 full-time folks from Paulsboro that are working in the Paulsboro PFAS Health Study Office, and we are really excited and happy to have them. We're going to be bringing on 2 part-timers in addition, but right now our full-time staff is Tanya Kidd, we have Nancy Victor, and we have Emma Dudlik. So, Tanya, would you mind just kicking us off, because it doesn't look like, could you just want to do 3 or 4 minutes before Rob gets here? Okay, you're muted. Do we need to unmute you?
Yes.
Okay, thank you. Go ahead.
Good evening, everyone. For those of you who know me, or do not know me, my name is Tanya Kidd. I am a resident, well, a former resident of Paulsboro. I was born and raised in Paulsboro. I attended Paulsboro school systems. I was a cheerleader in Paulsboro. I have family in Paulsboro still. So Paulsboro is very near and dear to me. It was a blessing to be able to work on this project. When I found out about the project, I immediately wanted to get involved. I was around when the train derailed, and I know that the PFAS chemical is separate from the vinyl chloride that was dispersed in the water back then. But, you know, after hearing about the PFAS and the contamination that took place, I immediately, you know, wanted to be a part of it. I feel that this is a very important study. I think the people in Paulsboro should be made aware of what's going on in the community environmentally. And the safety of Paulsboro is a concern for me, the residents and the people there. So I really am trying hard, along with Emma and Nancy, to you know, motivate the people to be a part of it, to come on board, to just have a simple blood test and a urine test to find out, you know, if there are elevated levels in your body. We do a lot in our community, and one of the things we're doing now is not just building from the people that we've serviced, you know, already. We try to make sure that in our office we're effective We're making the participants feel comfortable from the time they walk through the door until the time they leave. We want them to feel welcome. We want them to feel comfortable. We want them to have a great experience. Already they have questions when they come in. Some of them are skeptical about it. Some of them are hesitant. So we do our very best to, talk to them, to answer any questions they have, and to just make sure that, their experience is a positive one. And so far we've gotten good reactions from the people that come in. They'll come in and then they'll say, I really feel like you guys were, good, and you really made me feel comfortable. I was leery when I first walked in the door, but I really, am happy that I, took part. So that is our goal. We are doing some recruiting now. We're starting to get out more and try to, motivate some people outdoors. But for the most part, people are coming. They're starting to come. They're calling. Some folks are walking to the office and coming to the office. So the word is out. They're trying to, get scheduled. So we're grateful for that. I'm grateful that this test is being provided for the people in Paulsboro. Being one of 8 sites in our whole country, there's only 7 other sites, I believe, in the whole country. So for Paulsboro to be one of the sites to be able to test is a good thing. And so I'm really hoping going forward that they realize that other towns, surrounding towns, are having contamination issues too, but we're not able to test them. So I hope they know that, this is something that is good for us and for our town, and that they take advantage of it.
All right, no problem, Tanya. I'm going to bring you on back a little bit later. But Rob,
Okay.
Dr. Lumbach is here, and has about 10 minutes before he's got to go back to class, and then he's going to come back. So I'm going to bring you on a little bit later. Right now, thank you, Tanya, for that presentation. And Rob, go ahead and give us our update.
All right, great. Well, thank you. Sorry that I can't be here with you the whole time, and I really appreciate Ms. Carluccio and Ms. Gross being with us today. I do have a class that I'm teaching that couldn't be changed. So I'm not sure how much of an update has been given already, but we have had 300 participants at our site. I know Pennsylvania's a bit ahead of us and has been throughout, but we're trying to catch up. And we do have a small community in Paulsboro, and just to emphasize for those who may be on the call who aren't aware that it's not just people who live in Paulsboro currently, and in fact, it's really people who lived in Paulsboro from 2005 to 2014 when the contaminated well was shut down that we're interested in having participate in the study. So it could be folks who don't live in Paulsboro any longer, and on the other hand, people who do live in Paulsboro who weren't here between 2005 and 2014 also wouldn't be eligible to participate. And that's not that we wouldn't want to help those folks, but it's really part of the requirements of the study, again, across all of the sites where we have uniform types of eligibility requirements. So we have had over 300 participants totally, including somewhat over 30, probably I think Tanya's probably in better position to give us the numbers, but somewhat over 30 children. And this is really just since last fall. So we've really only been in business really because of COVID and some other delays, but primarily COVID, for the last year. And we only have until May of next year, 2023, to have additional participants take part. So we really want to, try to maximize, the involvement and engagement that we do in the community. And so Tanya is a big part of that, and Nancy Victor, who's another community a longstanding, community member who have been helping us. So we're really trying to pull out the stops. And I think one of the topics today I know is going to be about the NAS panel that both Ms. Carluccio and Ms. Gross were community members in terms of contributing, community representatives contributing, to those guidelines, which, do recommend that folks who have higher levels of exposure to PFAS, such as through drinking water, such as folks in Paulsboro who are exposed, that they be offered testing, that their clinicians or doctors offer them, testing, blood testing. And that's something that we're offering as part of the study. Perhaps, I may not be up on the latest in terms of insurance, but my understanding is that people can get PFAS testing now. In fact, there's a company that does it as a home test that you can get a kit and send in a small amount of your blood and have a test done for a number of PFAS compounds. But it costs over $300. And then insurance, my understanding is, doesn't cover that. So we're offering that as part of the study, in addition to, folks getting some additional, health information. But the most key important thing is really, finding out what their levels of exposure are or were, and just being more engaged. And I think, it hasn't been established, but, this is a cross-sectional study, meaning that we're looking at a certain point in time now what PFAS levels are in blood. We're going to, reconstruct the exposure in the past, try to estimate what it was in the past. But we're measuring health outcomes today and measuring, PFAS exposure today. And that's what we call a cross-sectional study. But in the future, there may be longitudinal studies that come from this. So one analogy to that is, we have a big study here, or we're part of a big study at Rutgers, which is the World Trade Center Exposure Response Cohort, World Trade Center Response Cohort, who were exposed to like the dust and other chemicals on 9/11. And they were initially evaluated cross-sectionally, meaning, again, like what's your exposure recently and what's your health effects now. But to follow people over time, may be an outcome of this study. And that would make the results that we're getting now even more valuable, as baseline results that then could be useful for future studies. So not only, useful for future studies, but the other point is that if you have your blood tested now and you learn your level, you do have some, again, sort of baseline information as well for yourself personally for the future. When we do have better ideas about what the actual levels of risk are for different levels of exposure. Because one thing that came out of the NAS panel was that, many people are exposed, and almost all of us have, essentially 100% of us have PFAS, measurable PFAS in our blood. But what levels of exposure cause what levels of risk is, something that we're trying to learn from this study. And when we do learn that in the future, then knowing what your level was currently at this time may be, especially important. So we really want to encourage, people to participate, both as a contribution really to the community, to their community in Paulsboro, to the, communities across the state who are exposed to PFAS, and people around the country and essentially around the world who are exposed to PFAS, contributing to our knowledge. But then also there's, some personal benefit as well that people will get from participating. And so I can't thank enough, like everybody, Kerry and Tanya and Nancy Kidd and Fatima Haynes on the call, who's a graduate student working on a project that we're, all working hard to try to maximize the benefit that we can get from this study. And so I appreciate everyone's efforts in that regard. And so I guess I may have to leave you in a few minutes, but again, I really want to thank also Tracy and Hope for joining us.
But we'll bring you back on, Rob. We'll bring you back on. So
okay, yeah, I'll come back. I think I can come back when the class is over.
If people want to ask questions, will you be back around 8?
Yes, yes.
Okay, that's awesome. So right now I want to now introduce Mayor Stevenson. He has been, our community advisory panel for this project has been amazing. And he's been an amazing support for the project. So I want to turn it over to him right now. You're muted, Mayor. We can unmute.
How about now?
Okay, there, you're perfect now.
You think I learned this after 2 years of COVID? The 63 things you forget quick. Listen, first apology. I told you I had a funeral service to run at my funeral home, so don't know if it's going to be one eulogy or 10 eulogies. You never predict when you get done, but thank you. And welcome to all of you that are on here. I certainly appreciate you taking your time out to be here. And I've said this before, but I'll just repeat myself. Thank you to Rutgers. Thank you to Carrie and Bob and that staff at Rutgers University for, getting this initiative and taking it to, find out exactly where all this is eventually going to lead to. It's not easy work. It's hard work. And I want to thank your workers, Tanya, I see you there, and all the other ones. I'm sorry I don't, Fatima, and everybody that works. The problem when you start saying names, you forget somebody. So and the benefit, well, first it's a local benefit, like Bob was saying, not only health-wise, but first you're renting a building. That's a Paulsboro building that was sitting there vacant, so that helps in a lot of ways. You got Paulsboro people working for you, whether it's full or part-time, so that contributes to them helping to their families. I do hear that a restaurant's going to open next to you. If it hasn't already, I don't know. So you ain't got to go far to grab a bite to eat, Vanessa's, so that's all good food there. But once again, the work you're doing is very tedious. A lot of phone calls, a lot of people go probably click, and you're working with those you just mentioned between 2005, 2014. Some people are like complaining, well, why can't it be me? I was here for one day during that time. So you are getting more people. I observed your booth at Paulsboro Day, and I want to thank for all the events, Carrie, that your group attends. You just haven't come into the community and say, hey, we're here and we want your blood. You've been participating in all our events, everything, whether it's a 4th of July parade, Paulsboro Day, Memorial Day, I'm sure there's a whole litany. You visited with town watch groups. And so thank you for making yourself not just sit in the office, but being out in the community. And I certainly appreciate all of you that you're doing. One of the things I get hit at, we got hit at council meeting last night, is our water. Is it safe? Let me tell you, we are probably now the safest water in the state of New Jersey, because we're like ground zero for first a train derailment and then this whole PFAS thing. And some people tend to mix those a little bit, but we've installed like the state-of-the-art systems to so make sure our water is safe. We're getting ready to add on to that state-of-the-art system with another set of filtering. So I can assure everybody that, and we have the state documentation to back this up, we're like probably the safest water in New Jersey. Of course, that doesn't help those prior. So that's what your study's about. Bob went into it. I'm not going to just keep repeating what Bob said, but people are going to find out where this is all going to eventually lead to. So thank you for all that you're doing. Thank you all that you're going to do. And I think, I think the more this word gets out, the more people are going to be on here. Question for you, Carrie. I was asked last night at the council meeting, is this going to be like where someone can YouTube it who was unable to get to this tonight?
Yes, we are recording it, and we're going to be able to get it out, hopefully at least by tomorrow, because I have a tech person with me, but maybe tonight. Let's see.
Okay, and then we'll get that word out through websites and Facebooks on the township and all that. So you got a lot of people on here, and I'm not going to hold up.
Not a whole lot, but we have a whole lot of readership on here. We have HYY on, we have New Jersey Spotlight on, and then we have Inside EPA on. So their readership, their circulation is probably in the hundreds of thousands. So we're lucky about that.
Oh, great.
But we don't have a lot of people on the meeting right now, but we'll get the word out on what's talked about here. But I appreciate you, Mayor Stevenson. You've always been amazing and welcoming, and it's been a pleasure to work with the community in Paulsboro, and we like being on the ground there. And we are going to be starting a recruitment. We are going to be going door to door because we feel it's important that every single person in Paulsboro has the opportunity to participate in the study. And we will be hanging door knockers on every single door. And we're going to be, we would love it if folks in Paulsboro wanted to volunteer and walk with us, but we are going to do what we've made a commitment to do every door in Paulsboro. So, but thank you again, Mayor Stevenson. And now I'm going to introduce Hope Gross she's the co-founder of the Bucksmont Coalition for Safer Water. She's just where you guys were in Warminster, Pennsylvania. She also drank water that was contaminated by PFAS. She's in our sister community in Pennsylvania. So let me introduce a very, very fabulous lady, Hope Gross.
Hi, everyone. Thanks for joining. Thanks for having me, Carrie. Yeah, I'm just over the bridge, and fortunately for our town, we are also part of we're the PA PFAS Health Study site, just like you all are. My name's Hope Gross, co-founder of Bucksmont Coalition for Safer Water, and also part of a national PFAS contamination coalition. I personally have had a lifetime of PFAS exposure. I grew up about 25 foot from Warminster Navy Base. That's closed now, but it was a super fun site in 1989 in Pennsylvania. And then I actually moved to Horsham and drank that water by Willow Grove Air Base. I'm actually working alongside with the PA PFAS Health Study site, consulting with RTI and the Pennsylvania Department of Health to help them recruit, do some social media, answer calls, bring awareness to the team regarding what the community needs, and how we go about, holding hands to get people into the office to give blood. So we are lucky, I guess, because we are almost at 1,000 adults. So our numbers, we're not there yet, but we're on the books to get there. And I think we're seeking approval to get more to add to our group. Our biggest push right now is families and children, because we all know we need 300 children to participate in the study. And what they've done now, which is super important, is break up the kids part, because there's a little more to it for the children. And, a lot of kids don't want to get stuck with a needle and whatnot. So they're able to do the questionnaire, the blood work, or the clinical psychological exam. So that has been good, because we've had a lot of hesitation with children not wanting a needle. You have to fast, so they're kind of trying to cater to the children in a better way. So we don't need them to fast to get a PFAS level. That's what I understand. So with that, we are pushing to get families right now to sign up for our study. Our town was polluted by the Department of Defense in Bucks County and Montgomery counties, where we had 2 military bases that were about 5 miles apart, who polluted our drinking water for over 30 years. I was a part of the National Academy of Science, and that was an amazing experience. And I'm grateful that the EPA or the ATSDR hired the National Academy of Science to do this work, because I feel like our EPA today has just been backlogged and their hands have been tied, it seems like to me. So I think that I just want to say that the things that I learned, and you can go on the site, and I know I saw the links up that you shared with everyone, Carrie, which is great, but this, because we're doing these studies and people are going to be getting their PFAS levels soon, they might be hesitant. What do I do? What am I going to do? And this clinician guideline has come up with some ideas, or given clinicians, doctors and nurses, on how to treat patients that have exposure to PFAS, using their serum, their plasma. It's also come up, the first report ever that's come up with an actual level of PFAS that is dangerous to your health, which is incredibly good for us to see, although we know that our clinicians and doctors may not and probably aren't savvy enough to understand it yet. But hopefully, I've been working with another group who has kind of piggybacked off of this, the National Academy of Sciences, and they're coming out, and I believe it will be tomorrow or by the end of the week, a short video for doctors to actually give them a little bit of a brief analysis on how to treat their patients. Because when the community gets these tests back and they have high levels, they need to call their doctors and they need to check in and get an exam so that they can be tracked for possibly hypertension, cancer, and to see what the risk factors are for, drinking the PFAS over, many, many years, or maybe it was just 5 years. But some of the science is showing that, you didn't have to drink it for 10 years. You didn't have to drink it for 20 years. And you don't need to drink a lot of it to have health effects. And some other things that came out of it were some links and associations between PFAS and increased risk of antibody response in adults and children, decreased infant and fetal growth, and kidney cancers in adults. There's some suggested evidence of increase in breast cancer, which we have not seen before. And although our community has had a lot of cancer, just like yours, I'm sure, it's good to feel like, wow, like, I don't know, for me, I feel like at least we're getting answers. Liver enzymes, there's a lot of pregnancy-induced hypertension, risk of testicular cancer in adults, thyroid disease, which is everywhere in my neighborhood, dysfunction. There's also even colitis in adults. And there's just a lot of health impacts, and even cardiovascular impacts with high cholesterol and reductions in birth weight. So with all that said, this is some of the stuff we learned going through this process. And it was almost 2 years that we were meeting with the National Academy of Sciences. And I felt like it was a very good experience because I feel like we're making progress, and it's, step by step. And now that we know, and I'm sure you all know, we have a HAL at 0.004. And we don't know how the EPA is going to start enforcing that, but we do know, at least by their map, that they are thinking about setting an MCL federally in October, which we're looking forward to, at least our town is. And I can't encourage you more than to get the blood done, because it's very expensive to do it. And I think it's most important for you, for your own personal health, to know, what your levels are today, because this stuff doesn't leave your body too quickly. And I think it's super important for the future of your family, and it's really important to be aware of what your PFAS levels are, and possibly maybe you have some health issues now and you don't even realize it's correlated with it. But if you do get those tests back, because you also get a panel with your cholesterol and a basic health assessment, take it to your doctor, because you just, they might catch something early, which is super important. Preventative health, that's, I think, what we need for PFAS. So thank you for having me.
It's always great to talk to you, Hope, and because the amount of participation you've done in this project is amazing, and the amount of advocacy that you've done, it's just, you've done a great job, and we appreciate you coming to Paulsboro. And we're gonna, now that there's a new place open, as the mayor said, last time Hope came, she went to the other place. So now you have another reason to come back and hang out with us for a little while.
Sounds good.
But it would be great maybe if there were some moms in Paulsboro, or moms, dads, grandmoms that might want to just do a round table with Hope one day. I think she would be willing to do that for us.
Absolutely.
All right,
Anytime. You're not that far.
thank you so much.
Thanks
Now
for
we're going to
inviting me.
introduce our public policy, where our attorney, not our attorney, I'm kidding, but my attorney, meaning I love her, Tracy Carluccio. She's the Deputy Director of the Delaware Riverkeeper Network. So go ahead, Tracy.
Thank you very much, Carrie, and thank you everybody for attending tonight, and thank you for the invitation to have Delaware Riverkeeper Network and myself here tonight. So here in New Jersey, we have higher concentrations than most other states of PFAS compounds in our water, and also in other environmental media. And we have more people exposed to PFAS because we're the most densely populated state in the nation. So these facts challenge the state to address all the sources of PFAS contamination and the public health issues that Hope was talking about that have resulted from a legacy and also a continuation of PFAS pollution. New Jersey has taken many important steps that other states have not, and more than the federal government, even though the US EPA did recently revise, as Hope mentioned, its health advisory levels for PFOA and PFOS to more realistic and protective levels for 2 of the thousands of PFAS compounds. New Jersey established maximum contaminant levels, which are the mandatory safe drinking water standards that require removal of the chemical from drinking water for 3 of the most important commonly found PFAS in the state, as you know, PFNA, PFOA, and PFOS. Recently, EPA also is proposing to designate PFOA and PFOS as hazardous substances, and that's under the Superfund law, and that's a really important federal action. I would like to point out that New Jersey has taken several regulatory actions. For instance, listing PFAS as a hazardous substance under certain state regulations, adopting groundwater standards, applying maximum contaminant levels to private water wells, as well as public water systems, and also issuing fish consumption advisories statewide for PFAS. And New Jersey scientists continue groundbreaking research and investigations. Yet, PFAS is so enormous a problem that more really needs to be done here in New Jersey and nationwide. The fact is, some New Jerseyans are still today drinking water contaminated with PFAS, and they may not even know it. Like peeling this never-ending onion, PFAS issues emerge in unexpected ways and unexpected places. The pathways of release and exposure are not fully monitored, assessed, or understood. Issues are delaying some towns' implementation of effective drinking water treatment in New Jersey. Destruction of PFAS waste is not settled. Some pollution sources continue to release PFAS. So-called replacement compounds are presenting new threats due to their toxic properties and the lack of adequate controls, and people still don't know what to do or how to protect themselves in most of New Jersey if they've been exposed. So I really would like to focus these next few minutes on this last issue, the issue of people who've been exposed to PFAS, which is the main topic, of course, of our meeting here tonight. I had the privilege, and I'm grateful to have served as a community liaison to the National Academy study that we've been talking about tonight. And I was really grateful to help to shape its direction and recommendations with my fellow liaisons, including Hope Gross. As you've heard, the report confirms the link between PFAS exposure and several diseases and adverse health conditions. I won't go through them again, but they are serious diseases. Hope covered them, cancers, decreased antibody response, like such as for response to vaccinations, And also decreased infant and fetal growth, very important for that vulnerable population. And these findings are really important for New Jersey, where so many people are exposed, where especially vulnerable and environmental justice populations are right in harm's way, and where contamination has come from many, many sources throughout the state. And also the three most important PFAS compounds, the ones that are most prevalent here in New Jersey, that's the PFOA, PFOS, and PFNA, are included in the National Academy's report, along with 4 others. So that also makes this especially relevant to us here in New Jersey. The recommendations in the report are made to the Centers for Disease Control clinical guidance and also public health departments for those who have been exposed to PFAS. Importantly, the report says blood testing is the first step in assessing health effects and of those with elevated exposure, and very specific guidance is offered if testing reveals high PFAS levels. A clinician, as Hope said, can actually use the guidance offered in this report to provide the much needed and currently practically non-existent medical screening needed for exposed patients. The recommendations in the report call for medical monitoring of these patients, something that many people have clamored for or have had to file a lawsuit or conduct an exhausting campaign to get. This is relevant for New Jersey because there are many who may have worked in or lived in communities or do now with known or suspected contamination. And there are many facilities in New Jersey that have used or still do use fluorochemicals, such as airports and military bases, wastewater treatment plants, farms where sewage sludge may have been used, or landfills or incinerators that have received waste containing PFAS, and of course the manufacturing plants that use or have used PFAS compounds. The Attorney General of New Jersey has filed lawsuits against the major corporations who have released PFAS into our environment in an effort to gain corporate accountability for this pollution. One manufacturing facility sued by the state that stands out as a source of PFAS contamination here is Solvay in West Deptford, New Jersey. A water crisis was triggered in 2013 when an expose of the presence of PFNA in municipal water led to 5 municipalities having to shut down wells, bottled water being handed out by Solvay, emergency treatment systems being installed, and several lawsuits. This was a traumatic experience for people in the Solvay area, which of course includes Paulsboro, which Paulsboro had the highest concentration of PFNA in New Jersey in the groundwater that feeds their municipal well at this time. And according to New Jersey DEP, this was the highest level at the time in the entire world. PFNA and other PFAS have been and continue to be released into our environment from Solvay, even though they have now replaced their perfluorinated chemicals with others. In fact, Solvay replaced the original PFNA with a replacement chemical that turned out to be more toxic than the PFNA itself, and which researchers have found traveled by air throughout not only the Delaware River region where the plant is located, but out to the far northeastern corner of New Jersey. A report was just released last week by Belgian researchers who visited the United States this spring. The startling findings are available in a report they've issued about Solvay's pollution in Italy and here in the United States. The University of Liège laboratories analyzed discharged water samples from Solvay's Spinetta, Italy plant and found people living near the plant are 5 times more exposed to PFOA than people living further away, and people in the most contaminated areas are up to 10 times more exposed. 55% of the Spinetta samples that were taken exceed the health value for PFOA set by the German Biomonitoring Commission. That's 10 parts per trillion. The scientists also analyzed the blood samples of Spinetta residents to see if the PFNA replacement compound that was used by Solvay here in West Deptford was present in their blood. They found it in 100% of the blood samples from Spinetta residents. They qualify their findings because they didn't have the analytical standard and had to develop one from other research that has been done on water in the United States, put together by New Jersey DEP scientists and the EPA. So they were unable to quantify precisely how much, but only to identify whether or not it was present, and it was. Additionally, in a municipality along the Delaware River, PFAS was found at levels that exceed New Jersey's maximum contaminant level in tap water. And this was from a sample that the investigators took when they were here in visiting New Jersey. These findings raise the question, is Solvay's highly toxic replacement compound in the blood of people who have been exposed to air and water from the plant here, Paulsboro and the other municipalities in the region around Solvay? And if so, what is it doing to their health? This question is urgently in need of an answer. So to close up, I want to say that for New Jersey, even the fastest pace by our government has not been able to fully protect us. Resistance by those companies that are responsible for the pollution and also the difficulties I mentioned earlier confound our PFAS problem. The extremely important blood study in Paulsboro and the National Academy's clinical guidance and confirmation of the need for blood studies and medical monitoring is crucial action that addresses the health effects of the exposure of New Jerseyans to these highly toxic forever chemicals. Further action by government, identifying all pollution sources and making polluters clean up and provide affected communities with safe water at the polluter's expense, expanding blood testing and medical monitoring to other impacted locations in New Jersey, ongoing litigation, and finally, a ban on the use of PFAS compounds are still critically needed, and they're needed now. So that's about all I want to cover in my 10 minutes here, but I'll stick around.
You did a great job, Tracy. I want to just refer folks, if they want to get involved in the Delaware Riverkeeper Network, they can. And also, the Paulsboro PFAS study is not involved in any kind of lawsuit. We just wanted to share that with you. We have to kind of let you know that we're not getting in the fray of any of that. All Rutgers is here to do is to find out if there are any health impacts from, and how much PFAS is in the blood of folks and the bodies of folks in Paulsboro, New Jersey. So, but thank you, Tracy, for all of your work and all of your advocacy. It's an amazing amount of information that you brought to the table. And, you know, we again, you know, there are probably going to be community members that see this that are going to want to bring you back. So I know that you're always willing to come back. So I appreciate that. So you guys both Hope and Tanya did a great job. I want to ask now if Councilwoman Karen Armstead is on by any chance. If she is, let me know and I will give her an opportunity to speak. If not, I can bring back Tanya if you want me to. If Tanya, you want me to bring you back? I didn't mean to cut you off earlier.
No, that's okay, Carrie. I just wanted to say thank you to Tracy, both Tracy and Hope, and to all of you for attending. This has been, you know, very informative information. And I just know that this just makes me feel that we have our work cut out in the township of in the town of Paulsboro. And I hope that if the residents do see this and they have questions, there is something or a way that they can actually ask the question on the internet or whatever. I'm not sure, Carrie, if that's going to be possible.
It's totally possible. I mean, they can get in touch with us through our website, right? And do you have it in front of us? Here, I have it in front of us. You can contact us through Paulsboro-Health Study at eoc.rutgers.edu. Fatima, can you print that in the chat? It's Paulsboro-Health Study. I'm sorry, Paulsboro-Health. Oh, somebody's calling me. Oh. It's paulsboro-healthstudy@eoc.rutgers.edu. And what we're going to do is we'll get that information out. You can always give us a call at 856-599-1205. We have 3. I think, Rob, are you back? Rob might not be back. He might be back in 10 minutes. So what I'm going to ask is, since we do have 3 journalists on the line, and also Amy from and the mayor from, if you want to ask any of the panelists any kind of questions, save the ones for Rob for 8 o'clock. Okay, here we go. Hope is putting in the National Academy's website. But I'm going to go ahead and just look at who was on first. Who came in first? Was it Zoe? I forget. All right, Zoe, if you want to ask a question, I'm going to go ahead and let you ask a question of if you're not ready, I'll go ahead and go to John. You want to go to John? You want to take a question? You want to ask?
Yeah, yes, please. Can you hear me?
Sure.
Okay. Well, so there's 300 people have signed up for the Paulsboro study so far. Less than a third of those that have signed up in Pennsylvania. Well, first of all, I mean, are you disappointed by this, and what accounts for this big deficit compared with the Pennsylvania side?
Well, there's only 6,000 people in Paulsboro, so actually we probably are doing, if you did it by how many people, I think, how many people is your area gross, like 60,000 or something?
Yeah, like 80,000.
All right, so if you looked at it that way, we are doing better than them if you look at percentage-wise. But yes, obviously we want to meet our numbers, and we want people to come in the door, and we're going to do everything we can to get the word out. And we do have a really top staff with Tanya and Nancy and Emma. And we're going to be doing, as I said, we're going to be walking the community. We're going to get, everybody is going to get a door knocker. So we're going to make sure that everybody who wants to participate has the opportunity to participate. But our numbers, we don't feel in any way ashamed of our numbers. They are what they are. They're 30%. We are currently right in the middle when it comes to where all of the states are, or where all of our participants are. Of course, Paulsboro is very competitive, so we're going to touch, especially Tanya, she's going to touch base with all of her competitive folks that are, it's a big football town, it's a big wrestling town, so it's a big competitive town. So we're going to try to bump our numbers up and get into a higher placement by the end of May, which is when we have that opportunity. And I think we're doing better with children. We're actually doing better with children as far as our numbers. And, we're not at all ashamed. We feel like the folks that come in have been really happy with our staff. And it's a very personal kind of a service that we offer. We'll make time for people different times. We'll do the questionnaires over the phone, and we are, at some point, we are going to actually, not right away, but before the end of the year, we'll most likely go to people's homes, if they can't make it to the office. Go ahead.
And if you don't get the 1,300 people by May of next year, does that mean that Paulsboro cannot participate in the study?
No, that doesn't mean that. We're gonna.
Okay.
I mean, the reason we're gonna pull the numbers up, and then there is talk, as Hope mentioned, of elongating the study a little bit. There is talk of it, so I don't want to say that's a possibility, but it's being talked about. I mean, it's certainly not a done deal, but they want everybody to meet their goals. And as I said, Paulsboro is right in the middle. We're not, we're not the top, we're not the bottom, we're right in the middle. And for a community, I think we have the smallest community. I think our 6,000, Tanya, you might know better than I do, but I think our community, we have 2,650 homes in Paulsboro.
Yes.
So we have to knock on every door. We have to, but we've been very lucky. People are, the best way of getting people is word of mouth. So when people come and they have a good experience, they're actually telling their neighbors and their friends. And, you know, we did just have a great event. Paulsboro Day was a marvelous event. And they basically said, people basically said, I know I'm coming. Everybody like shakes their head and they're like, I'm going to come in, I'm coming in. So we got about 50 additional names at Paulsboro Day. But, you know, it's not as scary. I know people, some people don't like needles, but we have some really good people in the office that make it, you know, I don't want to say it's the best, most fun, but they make it as painless as possible. And you know,
before this started,
are they what?
did you think that you would have? I'm sorry, but before this started, did you think you would have more people by now than you have?
I think COVID really kind of gave us all a pretty big boot, because I mean the one thing, we wanted people to feel comfortable and safe, and we wanted our staff to be comfortable and safe. And we, you know, we did stop testing. We did close our office for a little while. We never stopped working, but we did close our office for a little while. We had to, you know, that was just, you know, we had to. So Tanya, you can also answer that one if you want. What do you think?
Well, I think our numbers are pretty good because I joined the team in December and we didn't open the office until the end of February. So the end of February, the beginning of March. And I think at that time we had like 60 participants registered. They weren't all completed. So now we're looking at close to a third of the way. So we're near 350. And so to be a third away and just for, you know, a few months from March, I think we're doing fairly good. We're averaging anywhere from 2 to 4 children a week. And some of them don't complete the whole assessment. And that depends on the questionnaire. Some people can't do the neurobehavioral part, but they are able to do the blood draw and the urine and the questionnaire. So I think we're doing fairly well. And despite the fact that we've had some staffing issues as well. So we're working with a minimum staff, and we're just, you know, getting through it. We're doing what we need to do.
When you test somebody does come forward and they do the tests, do you notify them of their results straight away?
Well, what happens is we're notifying them. We're in a process right now of sending out the LabCorp results. So the participants will get their LabCorp results first. The PFAS results will come later because the CDC and ATSDR, they want us to ship them in bulk. And there's a lot that goes into that process with the manifest and the confidentiality. And there's so much that goes into it that those tests will come later. But we've had, go ahead.
Sorry, don't mean to interrupt, but I mean, so, you know, are you saying that there might be a period of months between the time that somebody gets tested for PFAS and the time they actually find out about it individually?
Yes.
I mean,
yes.
Is that fair? I mean, if somebody turns out to have a high PFAS level in his or her blood, should they really have to wait for however many months it might be?
Well, this is a good question for Rob. He's going to be on shortly. So let's re-ask that question to Rob. And John, do you mind if I give Zoe or
No, of course.
Suzanne, an opportunity to ask a question?
Yeah, of course.
No,
I'm
but
sorry. I didn't
we'll
mean
come
to be
back to
hogging
that.
this.
We're not going to not answer that. Okay. Oh,
Okay.
and then also look,
Okay.
in the chat is our for more information, and the email. You can ask a question. You can always call me or Tanya. But right now, go ahead. Either Zoe or Suzanne. You want to start with Zoe?
I was just wondering what the test results look like. Is it basically just a number, or is there a way for them to kind of interpret what those results mean to them, if that makes sense?
It does make sense. Is that another question for Rob, or do you have the answer to that, Tanya?
I don't have the answer to that because
Okay.
I've not seen the PFAS results.
Okay.
I know that there were tests done in Paulsboro prior, and I'm not sure who, was responsible for those tests or how they were interpreted. But I do know that, and I remember Dr. Lumbach talking about that, and he said that these tests would be interpreted in a way that people would be able to understand what their
Right. And Hope, do you know the answer to that question?
what their levels are.
Yeah, I know that we are in the midst of revamping our letters and so that people can understand it better. ATSDR is in charge of giving that information out. So we are, like I said, we're trying to vamp it so that people can understand and get good direction. Because I do know that PEACE is the test study site up in Mass, and theirs were a little hard to read. So we were able to get copies of theirs and try to make it better and make it easier for people. I know that the health study information was very easy to read. It's just basically cholesterol, what your thyroid levels were, and
Right.
It was pretty easy to see if you were off the charts on those and you were to contact your doctor. But the PFAS results actually is all controlled by the CDC and ATSDR.
Right. And I can tell you that we did a prior study. Rutgers did a prior study under Judith Graber as the PI. And what she did was she interpreted the blood tests that were done by the lawyer, by the previous court case. So anybody who volunteered to bring in their blood tests, they were interpreted a little bit by having Paulsboro folks compared to the NHANES number. Which, Fatima, are you on the line? You want to explain what NHANES is?
Oh yes, I have to remember the acronym.
All right, or else we can ask Rob. It's up to you.
I think it's a National Health Assessment. Let's see.
So it compares you to where everybody else throughout the country is. And we have those numbers. And Paulsboro was very, very high compared to the rest of the country. And I don't want to give you the wrong number. So I can get that information to you. We can get that previous study if you'd like it. I don't want to give you the wrong number though, but it was very, very high compared to the rest of the country. So, Suzanne, did you want to ask a question?
Yeah, sorry about that.
No problem.
This is for anyone familiar with the NAS study or report. Do you expect ATSDR or CDC to act on that report? And if so, how quickly? And if you can just kind of comment a little bit more about how profound their findings were, like how significant their advice is.
Tracy or Hope, you were both on that committee. Do you want to answer about how, Suzanne, correct me if I'm wrong, how significant their advice is?
Yeah, well, I would just say that it was really a significant report, and the findings were different than any other report has come out with. because they actually came up with recommendations for clinicians, helping them understand how to interpret blood sampling. And I think, you know, they had what they call the clinical follow-up and care portion of this report. And it talked, what they said is that the CDC should update its clinical guidance. And then that guidance is used by public health departments, you know, those in the health professional field. And those, the recommendations that they made should include things such as using your serum or your plasma concentrations combined for all PFAS when you do your analysis. Now, this is something that, you know, individual reports that have been done say is very important. It's also been said about water that you should be combining these in order to understand what the health effects could be. But in this study, this is the first time that a scientific study like this, that, as Hope said, took 2 years to develop with input from liaisons and a research of all the published literature that was available. And they came up with saying you should sum them all. And then they came up with a level, which they said patients whose tests show a blood concentration of PFAS of these 7 that they're included in the study, below 2 nanograms per liter are not expected to have health effects, but above that should be followed with medical screening. So, and then they have different levels that they look at. They say between 2 and 20 NGL per milliliter may have adverse health effects. And then they go on with results above that face, you know, high. If you go above 20, then you have a higher risk of adverse health effects. And they also, in their report, classify the types of health effects that are most likely or most strongly correlated with these exposures. So this is really a comprehensive report, and it's groundbreaking in a lot of ways. We haven't seen this kind of report come out from a scientific agency like this, making recommendations for changes to how the government is doing things through the Centers for Disease Control and the Agency for Toxic Substances and Disease Registry. So this is really a report that requires action. And the second part of your question, Suzanne, like, you know, when is this going to happen, or are they really going to do it? I think that remains to be seen. You know, the report has just come out recently, and CDC has not made any follow-up announcements or anything yet. But I think that the Centers for Disease Control were hungry for this kind of information. They were looking for it. And it's not like the academies said, we're going to do this and shove it at you. This was a cooperative effort. And the federal government was looking for this type of scientific and informed health guidance from, you know, national academies, which, you know, of course, is highly esteemed and rigorous in their investigations. So I think the other thing about this report that was really important to me and probably to all of the liaisons is that it did include community input. And there's just not that many studies like that that truly incorporate and reflect back what they heard from representatives of the community. And I think they did a pretty good job. The liaisons did submit a letter during this process outlining, you know, and sort of summarizing what we all had individually testified to when they had their, you know, the collection of information across by having these sessions across the United States. So, and that helped a lot too. But I think that was a really important part of this report too. So I don't know, Hope, if you want to, you know, add anything.
I just want to say real quick, I ditto what you're saying, and I think the biggest thing to me is that this was an independent study. This wasn't like in the past. I do feel like our government tends to, you know, do their own studies. This was an independent study and it was super important, and it prioritized, I think, human health. It's giving priority to, you know, what you're going to get in your blood results, and it also is a screening mechanism. It's huge. Like, you're going to be able to say, oh my gosh, I need to start screening for this because this or that, because no one's ever really said, what do I screen for? What do I look for? And this has broken down that pretty well. And I have to agree with Tracy. This is a step in the right direction. And like I said before, we're hoping an independent group it's not been announced yet, but it should be either later this week or next week, has pulled together a short video that we are hoping to plan to take to the states, Department of Health, all over the United States, to hopefully, you know, have continuing education. You know, the physicians this needs to be on the docket for our Department of Health, and New Jersey's Department of Health, Pennsylvania's Department of Health, especially where people have been so highly impacted by these, by PFAS.
Excellent. I see that Rob has joined us back from his class. So there was a question, Rob, when you were gone, and it was posed by John Hurdle. And it was a question. John, are you still on?
Yes, I am.
Go ahead and repose that question. You have an opportunity to ask Dr. Rob Lumba.
Yeah, hi, Rob. So my question is whether there is a lag between the point where you obtain the PFAS test results for any individual and the time when that individual is informed of those results.
Well, that's a good question. Right now, you know, the big lag is that all the samples, or a good part of them, are going to be batched together. So we're not going to get the results ourselves, you know, for quite a while to be able to distribute them. And then we haven't really talked about that much yet, but my assumption is that, you know, within the study, we haven't talked that much about how quickly we're going to be disseminating them, but back to people, back to individuals. But that I imagine that there shouldn't be any reason not to send them back immediately when we get them. But the big holdup right now is us getting them back from the CDC so we can give them back to people, because, you know, they do a lot of samples. It's a big endeavor. They want to sort of do them all at once. There's a reason to do them all at once too, and that's to get more reliable results that are more comparable one to another, because the assay might change over time. So the idea is to, again, try to do them together to get better results as well.
So are you saying that you haven't received any PFAS results back from CDC yet?
Right. Yes. Yeah.
And when do you expect that you will get the first batch of results?
Well, we just sent in the first batch of samples in order to try to get things speeded up a little bit. The ATSDR, the laboratory, said they would accept 50 samples from each site as priority samples, meaning really the first samples that we collected. So we've sent those in already. My understanding is that it's on the order of months to get them back once we send them in. So, you know, there's exposure studies going on across the country. The CDC lab is the main, you know, laboratory for a lot of studies. So they do have, you know, a queue.
Right. So it sounds like, bottom line, it's going to be a period of months between the time that that someone is tested and the time that he or she finds out the results of that test.
Yes. Yes.
Right.
Yeah, but you know, one important point maybe is, unlike, you know, many chemical exposures that we might be concerned about, where the amount of chemical in the body changes quickly over time. So if it's, you know, elevated now, I want to know about it now and do something about it.
Mm-hmm.
Now, with PFAS, unfortunately, and on the other hand, unfortunately, because it does stay in the body for such a long period of time, like the half-life for PFNA, which is the major compound in Paulsboro, we estimate from some of our results is like 4 years. So meaning it only goes down by half over 4 years. So so it doesn't change rapidly. The result that people would get, in 3 months is going to be similar. With the water, at least the water source in Paulsboro, the well was shut down. Currently the water, is still contaminated underground, but it's being treated to remove the PFAS. That there isn't that kind of urgency to necessarily. Certainly, there's other sources of exposure that people have, and that the results might be informative about other sources. So we'd like to get the results back as quickly as possible, but there is going to be a delay.
Okay, thank you.
Can I just add real quick, Carrie? So,
Sure.
John, there's just one lab that's doing the whole U.S. reports. I just want to make sure you understand that for the PFAS. So the health results are coming back quicker, and the people, like our site people, are getting them. They're behind, but they're getting them, and then they'll get a second report that's a PFAS level. And again, that level is just one lab that's doing all of ours. So we have heard it's going to take months. So it is very frustrating, to be honest. It's hard to believe. We had a press conference here and a tour at Warminster with Rob Ballot, and he was pretty shocked that it was taking the CDC and HESDR that long to give us these results. So thanks.
Okay.
Okay, anybody else? I see that the mayor is still on. I see Amy, one of our stakeholder advisory board members, our community advisory panel members on. If either one of you would like to ask a question of the presenters also, you can feel free. If not, I'll give it the closing statement to Rob.
Can
Okay, we have,
Sorry,
we have the mayor. Go ahead.
And I appreciate everyone on here. John, good to see you. I think we did a talk not long ago.
Yeah. Hi, Mayor. Yes, good
my
to see
condolences on the loss of the Queen.
Thank you very much.
And I sincerely mean that. I'm not, but I like how the media wants to see what shoes people are wearing, not talk about what the Queen's life was. And as Harry's fighting with this one, oh my gosh! But
yes, I know we've all had enough of that stuff.
I think so. So, and my sincere condolences on a fine lady that passed away. Really, really. So, Hope and Tracy, and I think probably this is for you folks because obviously being on the political end. And I know you're from PA, Hope, and I love listening to you. And Tracy, thank you very much. The reception on the state and maybe even the federal legislators on all this, do they just say, yes, we applaud what you're doing, and you don't hear from them? What has been the take on the legislators pushing that, for all of this for the taxpayers? And trust me, we spent millions so far that we have to recoup somehow, some way on filter systems. So I'm gonna, Tracy, Hope, whoever, how support or not support, or just smile, we're with you, and then we go away?
Well, you probably know that the New Jersey legislature, one of the committees, had a hearing this year on what the state legislature should be doing that New Jersey hasn't already done. And there were several ideas thrown out there. There was a lot of debate about whether or not PFAS should be regulated as a class. A lot of in the weeds kinds of arguments that wouldn't move, the general public. I think that they may have felt that they were kind of MIA for a long period of time, and the legislature was. And Mayor, I think Paulsboro knows better than anyone else. The reason that we got action in 2013 was because Paulsboro stepped up. And the municipal leaders, the mayors of the towns and the town councils of the 5 municipalities that had to shut down their water wells are the ones that wrote the letters and shook the bars down in Trenton. And the result was that the assembly person stepped up, the state senator stepped up, and finally after a lot of pushing on the part of municipalities and environmental, my organization, Delaware Riverkeeper Network, other activists, finally, the governor took notice. And it took that kind of interest and sort of bottom-up advocacy on the part of the municipalities to make something happen. And what needed to happen is the reconvening of the Drinking Water Quality Institute, which had been shut down by Governor Christie at the time. And because of all of that happened in 2013, he finally in 2014 reconvened that institute, which is under the Safe Drinking Water Act in New Jersey, the agency that is responsible for developing and then recommending the maximum contaminant levels. So nothing could be done that would mandate the removal of these chemicals from drinking water in New Jersey until that institute had a working board. And so they had been shut down, and I have my own evidence of why they were shut down. I believe it was because of PFAS, and I think the Chemistry Council played a big part in that, including DuPont. But I think really the most important thing is that it happened because the municipalities stood up for their residents, and the people wouldn't take it. The people stood up and said, we're not going to be living off bottled water for our drinking water source. We're not going to be breathing this stuff. We're not going to know, whether or not our families are safe. We want clean water, and it's our right. And it worked. It did take time. And I think, Mayor, you and Paulsboro were the tip of the spear. You're the ones that sent a notice of intent to sue, and I'm sorry, Carrie, this has nothing to do with lawsuits, but I have to say that it was Paulsboro's notice of intent to sue to Solvay that really got some action, and their letter to Governor Christie. So I think history shows that, we can get support from the legislature, but in a lot of ways, the people lead and the local leaders are the leaders. And it's because the people and the local leaders don't want to accept a travesty such as polluted drinking water that just by drinking what comes out of your tap can endanger your health and your family's health.
Thank you.
One of the, I don't want to say roadblock, but, we took Solvay, settled that. Now it's even worth more because more things have come out, but so I'm not going to get in that, but, one of the roadblocks we keep encountering is every time I call my state representative, I guess the DEP is what I'm going to say, there's always some change of leadership up there or something. My God, they go through heads of the DEP like you wouldn't believe. Every year and everything always keeps going, well, now he has to be informed. It just gets pushed back further and further. And so when you were talking, or whoever was talking about the attorney general, that they're going after and all, I'm just wondering, okay, I got to put new filter systems in all the time, changing, and it's many, many thousands of dollars to change those filter systems out. And it's like, I wonder how long all of this is going to take before certain companies are held accountable. And, and I got to be honest, I got to put my money hat on, my budget hat here, and we get money to pay for it, because right now we're paying for all this, most of it anyway. So I just wonder how long this will just drag out, and this company fights and this company fights. So
I think it takes time, but I think it is going to go somewhere. I don't think it's a spinning of wheels. I think lawsuits are never quick, and suing the responsible parties is billions of dollars. And really, the immediate needs are supposed to be helping you out under the New Jersey Spill Fund. And so, that is money that should be coming into your pockets pretty quickly through, the state spill fund. Not every state has that sort of a money pass-through fund. So that's very important. But I think also the responsible parties, those who made a lot of money, billions and billions of dollars off manufacturing this stuff and let all of the pollution out into the community, are the ones that have to pay in the end. And I know that it is an active litigation. I don't know too much about it. None of the public does, because a lot of it is confidential. It's behind a privileged veil. But I think I think it will go somewhere, Mayor Stevenson. I don't know. It has already been going for 3 years. So, you know, it's not over, but it certainly should be getting to the point where we're going to see some cash, because everybody is feeling this pinch. I mean, there are towns that don't have working systems because they don't have the money to do it. And this is, you know, absolutely wrong. So I think it's going. I don't know when it's going to get there. It's very frustrating in the meantime, though.
Okay, it's getting around that time. It's 8:25. I want to say thank you to everybody. I'm going to let Rob wrap us up here. And Tanya, real quick before Rob does, you want to just make a parting statement?
No, I just want to thank everyone again for coming out. Just know that we are working hard in Paulsboro to do what we can to make the residents aware, to get them out and to get them processed. We're just doing whatever we can. And I hope that, like you said, this video will be available for them to watch, because it was a very, very informative video, Zoom meeting. And I think a lot of questions that they may have could have been answered if they, you know, were able to listen in. So thank you all, and we'll talk next time. Until next time.
Okay, Rob,
Yeah,
you want to give a closing statement? And
yeah, I'm sorry that I missed most of the meeting. It sounds like it was informative, and I wish I'd been here. And again, I really appreciate everybody's, you know, support, you know, for the study, and Tracy and Hope coming out and supporting us and helping us, and the mayor, of course, and John and Zoe and others on the call. So really, we're moving forward, and we definitely will keep people informed as to how things are going. And we look forward again to having more participation as we go forward. And again, thank everybody for their help and support so far.
yeah, thank you, everybody. Have a
Thank
great
you,
day.
Carrie.
Thank you.
All right.
Have a good
Call
night.
us about anything. Call us for any reason. Thank you.